I'm Stacy. I'm going to be your nurse. I'm going to wash my hands real quick. I'm also going to close the door for privacy. Can I get your full name?
Alex Brook,
And your date of birth?
4/12/89.
Do you have any allergies? Okay. And how old are you, Alex?
24.
Patient appears to be stated age. Do you know where you are?
At the hospital.
Do you know why you're here?
Just a checkup.
Okay. Patient appears to be alert and oriented ×4. How are you feeling today?
Good.
Patient's mood and affect are congruent. Are you experiencing any pain?
Mm-mm.
Patient's posture also looks good. Patient's speech is clear. I'm going to go ahead and start your head to toe assessment. I'm going to start with your head and move to your toes. I'm going to start by feeling your skull here. This is for shape and symmetry. I don't see any signs of lesions. I don't see any parasites. I'm going to go ahead and test for cranial nerves 5 and 7. I'm going to have you close your eyes and let me know when you feel my finger touch your face.
Mm-hmm. Yeah. Mm-hmm. Mm-hmm. Yeah.
And I'm going to have you puff out your cheeks and smile and blink. All right, and I'm going to start with your eyes. I'm going to pull your eyelids down, and I'm looking at the conjunctiva, and it looks a pale pink, so that looks normal. Your eyes are symmetrical, they're round, the color looks good. I am going to move to your mouth, and before I move to your mouth, I'm going to check your eyes for perla, which is the pupils are equal, round, reactive to light, and accommodation. So I'm going to shine the light in one eye. I'm going to make sure that there's consensual contraction of the other eye, or the other pupil. Okay. I'm also going to have you follow my pen. And that checks for accommodation. I'm going to have you open your mouth. Looking at the mucous membrane, and that looks moist, pink. Your tongue looks moist and normal. Can you say ah? Uvula is in the midline. That looks normal. There's an absence of tonsils, so I'm going to note that in the chart. Your teeth look healthy. Do you have any dentures? Okay. There's no signs of decay. Your gums look good. Hard and soft palate look good. I am going to palpate your lymph nodes. I'm going to start with your preauricular and postauricular. And this is your jugulo-digastric, occipital, submandibular, submental, posterior cervical, superficial cervical, and this is your deep cervical chain, and then your supraclavicular lymph nodes. Was there any tenderness? Okay, and those all felt normal. I didn't feel any swelling. I'm going to go ahead and palpate your carotids bilaterally. Okay, and those felt even. I'm also going to listen with my bell and see if I hear any signs of bruits. Okay, and I'm going to go ahead and move to your lung sounds. And I'm going to do this in 10 different spots on your back. And I'm going to use the Z pattern. I want you to go ahead and take a deep breath when you feel my stethoscope. And breathe in through your nose, out through your mouth. Okay, so far that sounds good. I don't hear any adventitious sounds. Your AP diameter also looks appropriate, 2 to 1. I'm going to listen to your lungs from the front now. Your lungs sound good, nice and clear. I'm gonna go ahead and listen to your heart. And I'm gonna start at your aortic, and then your pulmonic, and your herbs area. This is your tricuspid, and your mitral, and I'm gonna listen to your mitral for a full minute. Then I'm gonna switch over to my bell, and I'm gonna listen again for a full minute. This is also down at the mitral. I'm gonna hear S1 the loudest. And then your tricuspid, herbs area, pulmonic, and aortic. And then I'm going to hear S2 the loudest up at the base of your heart. And I'm gonna go ahead and check your arms. I'm gonna check for temperature. Seems to be bilaterally warm. The color looks appropriate for ethnicity. No signs of lesions, any abnormal moles that I need to worry about. I'm going to check your fingernails. Look nice and pink. There's appropriate capillary refill on both. I'm gonna have you squeeze my fingers. Okay, there's good strength there. I'm gonna check your pulses now. I'm gonna do this bilaterally and compare the sides. This is your radial. And your radial on this side. You feel even. This is your ulnar. Again, your ulnar. And your brachial. And then brachial on this side. Okay, those all feel good. I'm going to have you go ahead and lay back. And I'm going to start by looking at your abdomen. I'd lift up your shirt. The contour looks good, shape, color is appropriate for ethnicity. I don't see any signs of scarring, lesions. I'm going to go ahead and start by listening to your bowel sounds. And there should be some presence of sounds here. I'm going to start in your right lower quadrant and move up to your right upper, left upper, and left lower. There seems to be normal bowel sounds. I am going to percuss starting in your right lower, and I'm percussing for dullness and tympany. And there should be dullness over organs and stool, organs such as your liver. I'm going to softly palpate, starting in your right lower. This is where you would find your appendix. Your right upper is where you'd find your liver. And then your spleen is in your left upper. Okay, and everything feels normal. I don't notice any signs of bulging. I'm going to go ahead and move down to your feet. I'm checking for temperature. Seems to be bilaterally warm. Edema. I don't see any signs of edema. There's no pitting. I'm going to check your pulses. And I'm going to do this bilaterally. This is your posterior tibial. And I'm going to compare to the other side. Okay, and your dorsalis pedis. And again, I'm going to compare. Okay, and I am going to check your toes and your nails of your toes. Nice and pink, capillary refill looks good. I'm going to have you put your feet up, and I'm going to do the Babinski test. Okay, and that seems to be negative, which is appropriate for adults. And I'm going to have you stand up. Go ahead and step down. Again, AP diameter looks good. I'm going to have you go ahead and walk to the other side. I'm assessing your gait. Walk back. Okay, gait looks normal. There's no signs of shuffling. I'm going to have you bend down and touch your toes. And I am palpating and inspecting the spine. I don't see any signs of curvature or scoliosis. And I'm gonna have you turn around, and I'm testing your kidneys right now, so let me know if you feel any tenderness. Any tenderness? Okay. And I'll have you turn around. I'm gonna have you shut your eyes, and I'm doing the Romberg test. I'm gonna stand close for safety. You'll stand here for 30 seconds. Okay, that looks good. Do you have any questions or concerns? All right, thank you.